Hi, this is Michelle, public health nurse from Peach Springs Indian Health Center. The facts don't lie. Nearly 50 million people in the United States have high blood pressure, and anyone can get it. American Indians, Alaska Natives are less likely to be treated for their high blood pressure. High blood pressure, also called hypertension, can lead to stroke, heart attack, kidney failure, and blindness.
Your blood pressure spokwali ya wikiot muito ya blood pressure ba. It only takes a few minutes and it's important. I could get supportive jam. Me why you kayo via muchum by spoka.
Hi, I'm Mary Lou from Peach Springs Health Center. Facts about blood pressure. Blood pressure is the force of the blood against the walls of your arteries. Blood pressure is needed to move the blood through your body. Measuring blood pressure is easy and does not hurt. Your blood pressure reading has two numbers. For example, 120/80. Both numbers are important. The first number, 120, is the pressure of the blood when the heart beats, and the second number, 80, is the pressure when the heart rests. It is written 120/80. It is important to know and remember your blood pressure numbers, just like you know your shoe size. Do you know your blood pressure number? It is best to have a blood pressure less than 120/80. Blood pressure between 120/80 and 139/89 is pre-hypertension. This means that you don't have high blood pressure yet, but are likely to develop it in the future unless you adopt healthy lifestyle changes. Blood pressure is considered high when it is 140/90 or higher.
Red alert.
If you have high blood pressure, it means that your heart has to pump harder than it should to get blood to all parts of your body. High blood pressure raises your chances for a stroke and heart attack, kidney problems, and blindness.
Red alert.
Hi, I'm Dr. Blair Revak, one of the physicians on the team at Peach Springs Health Center. High blood pressure is also known as the silent killer. It's called the silent killer because it may cause no symptoms. Most people have it without feeling sick until they have a stroke or a heart attack or some other problem caused by high blood pressure. But the best way to find out if you have high blood pressure is to have it checked. If you have high blood pressure, your doctor or nurse will check it at most visits to the clinic. You may also check that blood pressure when you are in Walmart or one of the Safeway grocery stores.
Ya machine with yem by wihikwa. Sometimes I could create walk miyomwita ihike. So then you bring him the records.
Bring those numbers to the clinic so that the doctor and or nurse can review those blood pressure numbers with you. They show that you are in good control. Ask for your blood pressure numbers each time you have it checked at the clinic. Keep a record of each reading on a card so that you know how your blood pressure is doing. Let's look at a visual aid that shows more information about the blood pressure. What your blood pressure numbers mean. Age 18 and older are the actual guidelines for these numbers. If the first number is less than 120 and the second number is less than 80, good for you. You have normal blood pressure. If the first number is between 120 and 139, and the second number between 80 and 89, it's time to make changes in what you eat and drink, your activity, your weight, and smoking habits. Things you can do on your own. Talk to the doctor, especially if you have diabetes. We now know that blood pressures above these numbers in people who have diabetes put them at significant risk of stroke and heart attack, more so than in people who do not have diabetes.
Red alert, red alert.
If the first number is 140 or more and the second number is 90 or more, you have high blood pressure. Ask the doctor or nurse how to control it, and begin looking at those things we mentioned above also, the things you eat and drink, your activity, your weight, and smoking habits.
Camille, this is Dr. Charles Aponte. Today I'm going to talk about medicine for high blood pressure. Many people with high blood pressure may take more than one medicine to keep their blood pressure low. Some medicine can cause side effects or reactions, which can be corrected. If this happens, talk to your doctor. Eating more fruits and vegetables, cutting back on salt and sodium, losing weight, and being physically active can help your medicine work better. Type of medications: diuretics, commonly known as water pills. How it works: help your kidneys clear excess fluids and sodium from your body, which allow the blood vessel to widen to reduce your blood pressure. What you need to know: the doctor may give you potassium pills to offset the loss of potassium. You also can eat certain fruits that has potassium. Take medicine as the doctor tells you. The doctor may give you a diuretic alone or in combination with another blood pressure lowering medicine. Another medication is a beta blocker. Makes the heart beat slower and with less force, which helps the blood pressure go down. What you need to know: avoid beta blockers if you have asthma or a problem with your lungs. Do not stop the beta blocker medicine all at once. It can lead to a very large rise in blood pressure and increase your chance of a heart attack. Another medication is the calcium channel blocker. How it works: prevent calcium from entering the muscle cells of the heart and blood vessels. This action causes the blood vessels to relax, open wider, and lower the blood pressure. What you need to know: talk to your doctor before taking any allergy medicine. Thank you.
That's me, Rooney the pharmacist, and now I'm going to talk to you about another class of medications called the ACE inhibitors and the ARBs. Both types of medications work very much in the same way. They cause the blood vessels to relax and widen, so it makes it easier for the blood to flow through your vessels, very much like releasing extra pressure from an overinflated tire. A lot of you might know this medication by the names of Lisinopril or losartan. They have very little side effects and are very well tolerated, and they work very well in patients with diabetes and heart disease because they help protect the heart and the kidneys. All you have to really worry about this medication is if you are taking potassium supplements or salt substitutes in your diet.
This is Dr. David Revac at the Peach Springs Clinic.